Friends, many patients look at their cholesterol report and feel confused. They see LDL, HDL, triglycerides, total cholesterol, and sometimes the word dyslipidemia. Then they wonder which number matters most. Is this dangerous? Do I need medications? In this video, I will explain cholesterol disorders and dyslipidemia in simple language so you can understand what your numbers actually mean. Hi, I'm Dr. Joseph Gnanaraj. Welcome to Dr. Logic 360, where we simplify medicine and health. So, what is cholesterol? Cholesterol is a waxy, fatty substance in the body. Your body needs cholesterol to build cells and make certain hormones. So cholesterol itself is not bad. The problem happens when cholesterol particles are too high, too low, or out of balance. That is called a cholesterol disorder, or in medical terms, dyslipidemia. Dyslipidemia simply means abnormal levels of fats or lipids in the blood. This can include high LDL cholesterol, low LDL cholesterol, high triglycerides, or combination of these. So your cholesterol report is not just one number. It is more like your car dashboard. You need to understand each part. Now let's start with LDL. LDL is often called bad cholesterol. When LDL is too high, cholesterol can build up inside the walls of the arteries. Over time, that buildup can form plaques, narrow the arteries, and increase the risk of heart attacks and strokes. That is why doctors pay close attention to LDL. As a general guide, an LDL below 100 mg per deciliter is considered desirable for most patients. But if you have diabetes, heart attacks in the past, or strokes in the past, or kidney disease, or major risk factors, your doctor may want your LDL even lower, sometimes below 70 milligrams per deciliters. In some very high-risk patients, particularly in those who have had multiple heart attacks or strokes, doctors would recommend LDL levels less than 55 milligram per deciliter. So the important point is this: the right LDL goal is not the same for everyone. Healthy young person may have a different goal than someone with diabetes, kidney disease, previous heart attacks or stroke, or multiple risk factors. So when you see your LDL number, do not only ask, is this high? Ask, what should my LDL goal be based on my personal risk? Now let's focus on HDL. HDL is often called the good cholesterol because it carries cholesterol away from the arteries back to the liver, where the body can process and remove it. In general, an HDL above 40 mg per deciliter for men and above 50 mg per deciliter for women is considered healthy. Higher levels are usually better, but there is more to the story. High HDL does not automatically cancel out high LDL. Some patients say, my bad cholesterol is high, but my good cholesterol is also high, so I am fine. Not always. HDL is only one part of the equation. LDL, triglycerides, blood pressure, diabetes, smoking, family history, and lifestyle also matter. Triglycerides are another type of fat in the blood. Your body uses them to store extra energy from food. A normal triglyceride should be below 150 mg per deciliters. Levels between 150 and 199 are considered borderline high, and anything above 200 is high. Triglycerides can become high from excess calories, sugary foods, refined carbohydrates, alcohol, obesity, diabetes, thyroid problems, kidney disease, and some other medications. So if your triglycerides are high, do not ignore them. Ask why they are high and try to correct them. Now, the important part of the video. I want to mention two tests that are not on every standard cholesterol report. They are lipoprotein A and ApoB, okay, sometimes called LP little a. So the latest guidelines recommend that every individual should have their lipoprotein A or LP little a checked at least once in their lifetime. It is a special type of cholesterol which is genetically determined, and it makes your cholesterol extra stickier and increases your risk for strokes and heart attack many-fold. A level below 50 milligram per deciliter or below 125 nanomoles per liter is considered favorable. A level above 50 milligram per deciliter or above 125 nanomillimoles per liter is considered high. High LP little a increases the risk of heart attack, stroke, and even aortic valve disease such as aortic stenosis. This is independent of your other cholesterol numbers. So please check your LP little a at least once in your lifetime. Next one is ApoB, which is short for apolipoprotein B. Think of ApoB as a way to count the number of harmful cholesterol particles in your blood. Every LDL particle, every VLDL particle, and every LP little a particle carries one ApoB molecule. So ApoB tells your doctor how many of these bad particles are circulating in your blood, not just how much cholesterol they carry. This matters because sometimes your LDL cholesterol number looks fine, but you actually have a larger number of small cholesterol depleted particles that are still dangerous. In that case, ApoB would be high, even though LDL looks normal. In a healthy individual, ApoB should be below 100. In patients with diabetes or patients with heart attacks or strokes in the past or with kidney disease, the ApoB should be below 80. And if you are at extremely high risk, it should be below 65. Here's the important part. Many people focus only on total cholesterol, but total cholesterol alone does not tell the full story. Two people can have the same total cholesterol but very different LDL, HDL, and triglycerides. This is why your doctor looks at the full lipid panel. And as we just discussed, some doctors may also look at ApoB. And again, please check your lipoprotein A levels at least once in your lifetime. So what should patients do? First, understand your numbers, LDL, HDL, triglycerides, total cholesterol, and your personal risk. Ask your doctor to check your lipoprotein A at least once, and ApoB testing if appropriate. Second, focus on lifestyle modification, healthy eating, regular physical activity, not smoking, limiting alcohol, and reducing excess sugar and refined carbohydrates. Third, treat related conditions such as diabetes, high blood pressure, thyroid problems, and kidney disease. Fourth, understand that some patients need medication. Lifestyle is very important, but it may not be enough for everyone, especially if the risk is high or the cholesterol problem is genetic. If this video helped you, please like it and subscribe to Dr. Logic 360 for simple heart health education. Also, if you think somebody would benefit from this, please share with them. This is Dr. Gnanaraj signing off. Thanks for joining me.